Hello everyone, I'm Dr. Anil Kamath. I'm a senior consultant surgical oncologist here at Healius Cancer Clinic. Today, I'll talk to you all about the treatment of stomach cancer. Stomach cancer is not the most common cancer, but we do find it every now and it is more common in South India, especially in and around Karnataka and Tamil Nadu. So how is it treated? So once the diagnosis is reached, usually through an endoscopy, next we have to see how much the stomach cancer has spread. For this, we may prefer a CT scan or sometimes a PET scan. Then we classify the disease from 1 to 4, 1 being a very early cancer just confined to the stomach and 4 being cancer which has spread to other areas like the liver. So I'll talk to you how we treat the more common stages, which is 2 and 3. Now, the two most important treatment which are used are surgery and chemotherapy. Earlier, most of the stomach cancers used to be operated first, and sometimes they would go for chemotherapy. But that has changed in the last few years. Nowadays, any stomach cancer which is above the stage T2 is recommended for chemotherapy first, especially if there are lymph nodes in and around the stomach. These are the patients who should undergo chemotherapy first. The reason being, we have to shrink the tumor to the maximum possible extent so that the entire remaining tumor can be removed surgically. The surgical removal happens in a better way once chemotherapy is given initially. So that is the change which has happened in the past 1 or 2 decades. So what is the type of surgery which is done? So once the patient is given chemotherapy and we see a reduction in size, we recommend the patient for surgery. Surgery forms an essential part of the treatment. Surgery involves removal of the stomach. Now, depending on the location, we may decide whether to remove half the stomach, 3/4 or entire part of the stomach. And this is termed distal gastrectomy, subtotal gastrectomy, or total gastrectomy. Now, along with the removal of the stomach, it is very essential to address the lymph nodes also. Some lymph nodes in and around this part, we call it as D2 dissection. It's a very important part of the surgery. Once the stomach is removed, how do we reconstruct it? We usually bring the small intestine above and join it to the remaining stomach. If the entire stomach has been removed, we bring the intestine up to the esophagus, make a small pouch out of it, and join it to the esophagus. So this is the surgery which is done. The surgery nowadays is done laparoscopically and robotically, where the pain is much lesser and the patient can be discharged faster. Thank you.